Welcome to Learning Anatomy with Dr. Bakari. Here we simplify anatomy and we also learn anatomy with so much fun. In this lecture, we'll be looking at the oviduct. The oviduct can also be referred to as the fallopian tube or the uterine tube. Using this image by the side, this is where we have the oviduct here, carried in white. These oviducts are two in number. As we have one on this side, we also have the other one on the other side. And these are tubular extensions from the uterus. In this lecture, we would be looking at the morphology of the uterine tube, also highlighting the functions that they perform. In addition to this, we would be looking at some details that you should know as students of anatomy. The oviduct, we say, is also referred to as the fallopian tube or the uterine tube. Using this image by the side, this is where we have the oviduct here, arrowed in yellow. It is two in number, and as we have one on this side, we also have the other one on the other side. This paired structure is a tubular extension from the superior border of the uterus. This is where we have the uterus here at the central part, and you look at the superior border of the uterus, you see that there are tubular extensions from the two lateral ends, and this is where we have the formation or the creation of the oviduct. This oviduct is about 10 centimeters in length and about 1 centimeter in diameter. And if you look at the pattern by which it runs, after it emerges from the superior border of the body of the uterus at this region, you see that it is seen to be directed laterally towards the lateral pelvic wall. And you see it ascending and finally arcing over the ovaries. This is where we have the uterus at the central region. And this structure here that is arrowed in blue are the ovaries. So we also have two ovaries. We have one on this side and we have the other one on the other side. And after the emergence of this oviduct from the superior border of the body of the uterus, you see it running laterally, and this is where it is directed laterally before it finally ascends and also arc over the ovaries. And this is what is exhibited here in this image. And because of this pattern of movement, the oviduct is described as a tortuous structure because of the curvature that it exhibits during its course of movement. And it is important that we are able to describe but also understand why this is so. At this region here that is arrowed in black is where we have the ovarian ligament. The ovarian ligament is seen to connect the ovary to the uterus. If you look deep into the connections between the uterus, the uterine tube, and also the ovaries, you see that these three structures work together. And because of this, there is a form of connection that also occurs between them. So you have the ovarian ligament here connecting the ovary to the uterus. What you have at this other lateral end here, you have the terminal region of the oviduct arcing over the ovary. So this is trying to create a form of connection between these two structures, because the egg that is released in the ovary will be directed into the lumen of the fallopian tube. It is important for us to note that the uterine tube is seen as an intermediary structure between the uterus and also the ovary. And if you look at the way it is patterned, you agree with this statement. This is where we have the uterus at this central portion, and at this lateral edge here, we have the two ovaries. And remember, we described how the oviduct runs laterally and also arc over the ovary. So you see it as an intermediary structure located between the uterus at the central part and also the ovary at this other end. So let's drive further to highlight the functions of the oviduct. Let's try in details to explain what they do in respect to reproduction. This structure is responsible for transporting the egg that is released by the ovary into the specific region of the uterine tube where fertilization will occur. It is in the uterine tube that fertilization will occur. It is this same uterine tube that is also responsible for transporting the egg that is released by the ovary into the specific region of the uterine tube where this fertilization process will occur. If you go back to this image, this is where we have the ovary here arrowed in black. We know that the ovary is responsible for releasing the egg. It is within the ovary that we have the process of folliculogenesis, which of course will involve the process of egg maturation. And after the egg is mature enough for it to be released, it will be released. And at the point where it is released here, it is directed into the lumen of the uterine tube. So this uterine tube, through its muscular action and also its epithelium lining, it is able to drive this released egg down to the point within it where fertilization will occur. So the process of fertilization will occur at a specific region where the egg will need to be taken to for this process to be exhibited. So it is responsible for transporting the egg that is released at this end here to the ampulla region where the process of fertilization will occur. It is also the site of fertilization. We say that the process of fertilization where the sperm will meet with the egg will occur within the oviduct. But of course, it is a specific region of the oviduct, which is the ampulla region. And we'll be dwelling more on this as we go through with this lecture, where we'll be describing the different regions of the oviduct or the fallopian tube. So it creates a site for fertilization to occur. After the process of ovulation, fertilization should occur before finally implantation of the fertilized egg into the endometrium lining of the uterus. So the oviduct creates the site for fertilization. It is also responsible for secreting mucus. Also, within the mucosal lining of the uterine tubes, we have glands that are responsible for secreting substances. And these substances are responsible for supporting the structures that are located or positioned within the uterine tube. And these secrets are used to support the unfertilized oocyte. Remember, if you go back to the process of ovulation, we say that ovulation occurs in the ovary. After this ovulation process, the egg is released into this terminal end of the oviduct. This is not where fertilization will occur. Fertilization will occur in the ampulla region, which means that the egg will need to be driven or taken to this region. And during this course of movement, the egg also needs to be supported. And this support is provided by the secrets by the gland. It also helps to support the spermatozoa. We know that the spermatozoa is also needed for the process of fertilization because this is what will be creating the second half of the zygote. So when we have the release of the sperm cell into the vaginal canal, it also needs to be taken up to the point where fertilization will occur. So it needs to be driven also to the ampulla region because the ampulla region is what is designed for the process of fertilization. And this is a specific region of the uterine tube. So during the process of movement to the point where fertilization will occur, there is also the need for the spermatozoa to be supported. And it is through this secret that this is also provided. And finally, after the process of fertilization has occurred, where we then have the formation of the zygote, this will occur in the ampulla region. The next process should be implantation. This implantation also will not occur in the ampulla region because this is going to be creating an abnormality. The implantation needs to occur in the uterus. This means that the fertilized egg in the ampulla region will also need to be driven back into the uterus. So during the process of movement from where fertilization has occurred to the point where it will be implanted, this zygote also needs to be protected and also supported. And it is through this secret that this is also done. So you have mucosal glands within the uterine tube that are responsible for secreting fluid that helps to sustain the unfertilized oocyte, the spermatozoa, and also finally the formation of the zygote. So you see that they are sustained within the uterine tube due to the nutrients that is provided by these secrets. And finally, after fertilization, the next process is implantation. But we say that implantation also does not occur within the wall of the uterine tube. It occurs in the uterus. So after the formation of the zygote in the ampulla region, the zygote begins to divide. And this division, of course, will occur along the uterine tube. Before it is seen to exit the uterine tube, and finally implantation will occur in the uterus. So during the course of dividing also within the uterine tube, the uterine tube also will provide the accommodation for the dividing zygote before it finally exits this space to be implanted in the wall of the uterus. Now let's look at the two ends of the uterine tube. Remember that the uterine tube is a tubular structure and it will be seen to present two ends. So using this image here, this is where we say we have the uterine tube here, arrowed in yellow. We say that we have two, one on this side and also the other one on the other side. So this end here that is directed towards the ovary is the ovarian end. So this ovarian head is what is carried here in red. This ovarian head is seen to open into the peritoneal cavity. If you look at the connection between the terminal end here of the oviduct and also the ovary, you see that there is no structural connection between the oviduct and also the ovary at this region. So there is a link or opening into the peritoneal cavity, so that when the egg is released from the ovary, it is possible that this egg will be released into the peritoneal cavity. But this is not so, because there are measures put in place around the terminal region of the uterine tube that helps to suck in the egg as soon as it is released by the ovary. We will be dwelling more on this when we get to the regions of the oviduct. So please do watch along. And at this terminal region, we have the opening of the uterine tube into the peritoneal cavity. And this opening that is created around this terminal end of the oviduct is referred to as the abdominal ostium. So it is through this ostium that you have the opening of the uterine tube into the peritoneal cavity. Then on the other hand here, we have the uterine end. This is the end that is related to the uterus. And this is why it is so referred to as uterine end. And you see that the uterine end of the oviduct is opened into the superior border of the body of the uterus. This is where we have the uterus, and this is where we have the superior angle here, where the uterine end will open and also be connected through the uterus. So it is through this point that it is connected to the uterus. Remember, after fertilization, we said that the next phase is implantation, and this implantation process will occur in the uterus. So there needs to be connection between the oviduct and also the uterus, so that after fertilization, the zygote will be moved and be implanted into the uterine wall. And this is the connection that is created around this superior region. So you have the uterine end at this region because it is the end that is related to the uterus. And on this other end, you have the ovarian end because this end is related to the ovary. And if you look at it, you see that as soon as the egg is released, it needs to be sucked in into the lumen of the uterine tube. And it is through this egg that this will occur. And also after fertilization, the fertilized egg also needs to be implanted. And it is through this egg that this connection to the uterus, where implantation will occur, will also be created. So you see that these three structures, the ovary, the uterus, and also the oviduct, work together in exhibiting reproductive function. So in looking further to the structural connection between these structures, the uterus, the ovary, and also the fallopian tube, we would be looking at the ligament of the uterine tube. This ligament is also helping to create further structural connection between these three structures. So we look at the mesentery of the oviduct. The mesentery of the oviduct is specifically called the mesosalpinx. The mesosalpinx is a fold of peritoneum that is seen to connect the oviduct to the surrounding structure. If you look at this image by the side, this is where we have the oviduct here, carried in dotted yellow. And inferiorly here is where we have the mesentery of the oviduct that is referred to as the mesosalpinx. And this mesentery of the oviduct is seen to be connected to the mesentery of the other two structures that are located around this region. And this is where these three mesenteries will now come together to form the broad ligament. So we can say that the mesosalpinx, which is the mesentery of the oviduct, is a sub-region or sub-portion of the broad ligament. This broad ligament encompasses the mesentery that surrounds the three structures around this region. Let's dive deep into the broad ligament to see how they are patterned and also helping to now bring these three structures together. We know that mesentery basically helps to create structural support, and they are also create means through which the neurovascular structures will also reach the organ. So if you look at the broad ligament, we have three sub-regions. We have the mesosalpinx that we have initially described. We say that the mesosalpinx is the mesentery of the oviduct, and this is what is harrowed here in yellow. This is where we have the oviduct here, and this is where we have the mesentery of the oviduct. Then the next sub-region of the broad ligament is the mesovarium. Just from mere breaking down the name, mesentery of the ovary. So the mesovarium is also seen as a sub-region of the broad ligament. This is where we have the ovary here, arrowed in dotted black, and this is where we have the ovarian ligaments, also arrowed here in dotted black. If we described the ovarian ligament in our previous slide, where we say that this ligament is connecting the ovary to the lateral border or wall of the uterus. And this is what is projected here in this image. Then if you go more superiorly here above, we have the mesovarium. This is where we have the mesovarium here, arrowed in black. If you look at the mesovarium at this upper end, and you look at the mesosalpinx, you see that they are seen to be connected at this region. And if you go more inferiorly, you have the mesometrium. The mesometrium is the mesentery of the uterus. This is where we have the uterus here, arrowed in dotted red, and this is where we have the mesentery of the uterus that is arrowed here in red. So if you take these three mesenteries, the mesometrium, the mesovarium, and also the mesosalpinx, if you now take them together, they will now be seen as the broad ligament. And you can see how the broad ligament is seen as a broad fold of peritoneum that is helping to bring the three structures together. Where you have specific regions of this broad ligament will be tagged specific name. And these names will be related to the structures that they are related to. So if you look at the broad ligament around the region of the uterus, it will be referred to as the mesometrium. And if you look at the broad ligament around this upper region that is related to the ovary, it will be referred to as the mesovarium. Then if you go more superiorly here, you have the sub-region of the broad ligament that is related to the oviduct, it will be referred to as the mesosalpinx. So if you take these three mesenteries together, the mesosalpinx, the mesovarium, and also the mesometrium, you see that these structures will come together to form the broad ligament. And if you look at how they are arranged, you see that the broad ligament is helping to structurally connect the uterus, the ovary, and also the oviduct. And this is what it has provided around this region. And it is important that we are able to highlight this structural support that is created by the broad ligament. So we can see at the end that the uterine tube is seen at the upper free border of the broad ligament. If you look at the broad ligament, you see that the uterine tube is located at the superior free border of the broad ligament. So you can see that the broad ligament in this regard is helping to connect these two structures and also helping to position them in place. We know that these structures, they are soft tissue and they need to be well positioned and also well guided. And this is where this ligament has come to play this role. So let's drive through the sub-regions of the oviduct. If you look at this image here, we already created this alignment here in dotted colors. So this region here that is arrowed here in red is the intermedial or the interstitial subregion. This can also be referred to as the intrauterine subregion. It is intrauterine because it is located within the myometrium of the uterus. If you look at the central region, this is where we have the uterus, and we say that we have an extension here that is referred to as the uterine tube. If you look at the uterine tube, we still have sub-region of the uterine tube that is located still within the myometrium of the uterus. And this region that is arrowed here in red is the intramural region of the uterine tube. It can also be referred to as the interstitial region of the uterine tube. This is the initial segment of the uterine tube that is located still within the substance of the uterus. Then the next region is the isthmus. This isthmus is what is arrowed here in blue. This is the next region. And after this region, then we have the ampulla. This is the ampulla here that is arrowed here in yellow. Then finally, we have the terminal end that is referred to as the infundibulum. So these are the four sub-regions of the uterine tube or the oviduct. And this is what we've tried to highlight here in this image. So let's drive further to take each of these regions one after the other to highlight the features that they exhibit. So for the first region, the intermedial part, this region is what is demarcated here in this image. So you have it at this point that is arrowed here. We say that this region is located within the substance of the uterus. Although it is a part of the uterine tube, but it is still located within the myometrium of the uterus. And this is what is arrowed here in red. This is about 1 centimeter in length. And it is important for us to know that there is a sub-region of the uterine tube that is located still within the substance of the uterus. Then the second region is the isthmus. This isthmus is about 2 to 3 centimeters in length. This is what is also seen to be carried here in blue. This is a very short segment of the uterine tube, and it is thick-walled. And because of this, it means that the fertilization event cannot occur in this region because it is not creating the space for this to occur. So let's try to go to the ampulla. The ampulla is what is carried here in yellow. The ampulla is about 5 centimeters in length. It is the longest of all the sub-regions, and it is taking about half of the entire length of the uterine tube. It is also the widest, and the breadth of this region is about 1 centimeter. The wall is thin, which makes it to have more space within its lumen. Hence, this region is perfect and also conducive for the process of fertilization. Also, the mucosal microenvironment of the ampullar region also suits the process of fertilization. And this is why the process of fertilization occurs at this region. Then the last terminal region is the infundibulum. This is where we have the infundibulum here that is harrowed in black. This infundibulum presents a unique characteristics. If you look at the most terminal end of the infundibulum, you have a funnel-shaped lateral end here that ends with about 20 to 30 fimbriae. So you have a number of finger-like expressions or extensions around the terminal region of the infundibulum. And these are not just for fancy. These are seen to help suck in the egg that is released by the ovary. So it helps to trap the egg that is released by the ovary. And this is what this finger-like expression that is referred to as fimbriae exhibit around this region. Remember when we try to describe at the ends of the oviduct, we say that the terminal end of the ovarian region of the uterine tube is not structurally connected to the ovary. And there is the possibility of the released egg falling into the peritoneal cavity. But because of the suctioning mechanism that is put in place by the terminal end of the uterine tube, this is specifically exhibited by the fimbriae. The fimbriae sucking the egg as soon as it is released by the ovary, so that the egg will be prevented from falling out of place. So it is then sucked into the lumen of the uterine tube. But just for us to know that the terminal end, which is the fimbriae, is not structurally connected to the ovary. But we have just one of these fimbriae that connects with the ovary, and this is referred to as ovarian fimbriae. So we have just one, which of course is the longest of all these fimbriae, and this is what is able to create attachment or connection point with the ovary. But structurally, the entire fimbriae are not connected to the ovary. It's just that this suctioning mechanism that is put in place is helping to prevent the egg from falling out of place. And this is why it's helping to suck in the egg into the lumen of the uterine tube. You can see the interesting exhibition here around this fimbriae region of the uterine tube, and it is very important for us to highlight this. So let's look at the blood supply. The blood supply of the uterine tube is also very interesting. If you try to create a demarcation here along this region that is demarcated in dotted black, you see that you have the medial two-third around this region, and you have the lateral one-third around this region. The blood supply of these two sub-regions are different. Let's dive into this to see what provides supply to this. For the medial two-third, it is supplied by the uterine artery. And this is where we have the uterine artery here, providing supply for the medial two-third. And if you look at the medial two-third, you see that it is closer to the uterus. And this is why it's enjoying the blood supply from the uterus. So this is supplied by the uterine artery. And we know that the uterine artery is an emergence from the internal iliac artery. While the lateral one-third is from the ovarian artery. This is where we have the ovarian artery providing blood supply to the lateral one-third of the uterine tube. And if you look at how it is positioned, you see that it's actually also close to the ovary. And this is where it is enjoying the blood supply from the structure. And we know that the ovarian artery is not a branch from the internal iliac artery. It is a branch from the abdominal aorta. So let's look at the venous drainage. The venous drainage also is somewhat complicated, but also interesting, just as we have in the arterial supply. For the venous drainage, the medial two-third is drained by the uterine plexus. And this is what is highlighted here in dotted blue. So you have the medial two-third drained into the uterine plexus, which is finally drained into the internal iliac vein. And we know that the internal iliac vein will drain into the common iliac before finally draining into the inferior vena cava. And if you look at how it is also positioned, you can use the justification for the artery also to justify this. The medial two-third is also close to the uterine veins, and this is why it is so draining into it. While the lateral one-third is drained into the ovarian veins through the papiniform plexus. And this is what is also highlighted here in this region. So you see that because this region is closer to this particular organ, it is enjoying also the drainage of that region. But for the lateral one-third, the ovarian vein is not drained directly on both sides into the inferior vena cava. And this is justified. If you look at how the inferior vena cava is positioned, you can use this to justify why the ovarian vein on both the right and the left are not drained in the same pattern. If you look at the right ovarian vein, this is where we have the right side and this is where we have the left side. Remember that the ovarian vein only drains the lateral one-third of the uterine tube. And this is what is seen here in this region. So on the right side, after collecting venous blood from the lateral one-third of the uterine tube, it will be drained directly into the inferior vena cava. If you look at how the inferior vena cava is positioned, you see that it is directed more to the right. So it is easier to drain directly into it on the right. On the left, the ovarian vein is first drained directly into the renal vein. This is where we have the renal vein here, highlighted here in yellow, before it is finally drained into the inferior vena cava. And this is because of the position also of the inferior vena cava. The inferior vena cava is more positioned to the right. So it is easier for the left ovarian vein to first drain into the left renal vein. Before the left renal vein, we then take the venous blood into the inferior vena cava. We've also highlighted this in our previous lecture on the blood supply and venous drainage of the ovary. You can also go and check that hub to also upgrade your knowledge. So let's look at the innervation. The innervation is provided by sympathetic supply and also the parasympathetic supply. The sympathetic supply is through the spinal segment from T10 to L2. While the parasympathetic supply for the medial half and the lateral half are different. For the medial half, it is through the pelvic splanchnic nerve, while the lateral half is through the vagus nerve. So this is how the innervations of the uterine tube is presented. For the lymphatic drainage, it is into the internal iliac and also para-aortic lymph nodes. Let's look at clinical anatomy. Let's look at the fallopian tube obstruction. This is blockage of the lumen of the uterine tube, and this can occur as a result of infection. And this will prevent the passage of gametes through the lumen of the uterine tube. Remember, we described the functions of the uterine tube, where it is helping to transport the oocyte and also the sperm cell to the specific region within it where fertilization will occur. So when there is obstruction, it means that this gamete will not be able to pass, and it is going to make fertilization impossible. So if you have structure occluding the wall or the lumen of the uterine tube, you have fallopian tube obstruction. And this can be treated through surgical intervention that is referred to as tuboplasty. Tuboplasty is an invasive procedure where there is resectioning of the wall of the uterine tube so as to remove the occluded region. So this surgical intervention can be done to rescue the situation and to allow for the process of fertilization. Then we can have tubal pregnancy. Tubal pregnancy is the most common ectopic form of pregnancy, and this occurs when implantation occurs within the uterine tube. We know that implantation is supposed to occur within the uterus, but because of one reason or the other, the fertilized egg decides to implant itself within the uterine tube. This is referred to as tubal pregnancy. So thanks for watching this video. Let's continue to stay glued to this channel.